Diagnosis: hydrocephalus. And now? Hydrocephalus is a condition that is congenital or that develops later in life. There are very different forms of the condition. While in a healthy person, there is a balance between the production and absorption of cerebral fluid. In the case of hydrocephalus, too much fluid accumulates in the brain. This causes high pressure inside the head, which can cause a wide range of symptoms. Headache, difficulty walking, and nausea are the most common. The good news is that hydrocephalus can be treated. This usually requires the implantation of a shunt system that regulates the excess pressure. This sounds rather worrying at first, but the procedure has relatively few complications and normally takes less than an hour. This shunt system usually starts in the brain and drains any excess cerebral fluid into the abdominal cavity using a catheter inserted under the skin. The implant procedure generally involves just a few minor incisions and shaving of the affected area. Alternatively, the fluid can also be drained into the heart's atrial chamber or from the spinal cord into the abdominal cavity. The valve in the shunt system then helps to regulate the pressure in the head. Thanks to the instant reduction in pressure, many patients feel better shortly after the procedure. They rarely need to spend longer than 1 week in the hospital. During the post-operative period, patients should initially avoid physical exertion and sports. Depending on the underlying disease, life with hydrocephalus and a shunt can be without major limitations. In principle, patients can now do anything: take a plane, take a sauna, ride a roller coaster, or go diving. But hydrocephalus is not always the same, and possible complications may begin after surgery. So it is important that you always discuss any doubts or symptoms that occur with your physician. Symptoms can often be well regulated by means of adjustable valves. Every adjustment is documented in your implant card, which you must always have with you. Keeping a daily diary will also help you to better understand your own body and prepare for your next appointment with your doctor. A checkup is recommended once a year. Hydrocephalus is usually a lifelong condition. Therefore, stay up to date. Share your experience with other patients. Seek advice about products. And find out more about your implants.